So just as even like a case study on monetizing data, like esoteric, what you would think is esoteric data, but is actually really valuable. Talk a little bit about like a healthcare directory and how does that drive ROI for clients, even though you wouldn't necessarily connect that to like a data product or a data business that could have a lot of impact.
Yeah, and I categorize it into two use cases for that because you have the members and the consumers that utilize the product. And then you have our clients, the health plans and the insurance companies that are a buyer. So from the buyer's perspective, health plans and insurance companies, they can really be able to engage with their members or their policyholders or those patients to not only display the providers that are within that program, that member, but they can also promote certain providers over others. So if Dr. Solomon has 5 stars of quality versus Dr. April, they can really serve that up and share with that patient or that consumer to say, this provider is a better quality compared to their peers. And if you're, especially if you're going for surgery, right? So if someone's going in there and they're having a knee surgery, I may prefer to go to the practitioner that's done 300 of them in a year versus 4, right? So that's one way where, from our buyer's perspective, they want to make sure that their patients are happy and healthy and getting to the right provider for the right treatment. Another one is the use of the tool. The provider directory needs to be easy to use. It shouldn't be a Mensa test to get to a listing of providers. So easy to use, easy to understand, terminology that the regular person that's not in the industry can find a provider. And if you have a tool that is easy to use for your member population, then that's less phone calls into member services. And that directory is exposed to the provider community as well. So if the members and the providers can use the tool and answer the questions they have, then that's less calls into the call center and that it decreases their operational expenses.
Yeah, that's super interesting.
With the Transparency and Coverage Act, now all of that data is exposed. So it also enables consumers, if they're more cost conscious, that they can go in and they can find providers that will have a less out-of-pocket expenditure for them. And they can really shop around and identify. And that's a tool that's built into the directory. And that's the health plan serving that up for them. So you have a lot of ways that it benefits both the members for getting good quality, maybe low-cost care, and for those buyers of ours that can expose all this information, be transparent about it. And the last piece of it is if they are also cleansing the provider data that's in that tool, tons of legislation has been around and is always going to be around and more to come from not only the federal government, but the state. The local governments have said, if you're going to offer an insurance product and people are going to buy insurance products based on not only cost of the product, but also what doctors are in there, you better have good, accurate data because people are making buying decisions based on your directories. So in those cases, making sure that the data is accurate, you're not putting a doctor in there that's not part of the plan, that really does reduce better exposures for them in the public from a PR perspective. They're not going to get dinged by the Department of Insurance, and they're not going to get fined with the state and federal government to say you're selling something that's inaccurate, has inaccurate data, and that people are buying.
Yeah.
So multiple use cases of benefit to the
Man,
end user and to the buyer as well.